So welcome everyone to this CHI cross-cutting theme. I'm Sarah Rogers and I'm the CHI lead for this theme, and I'm live with you here this morning along with Ollie Butters, a CHI Senior Research Officer. We're going to start with a description of the strategy for CHI, is an interview and a short discussion, and then Ollie's going to be talking about something called Puma. And then we're going to hear from our data science intern and a recently started PhD student. And hopefully we'll have a little bit of time to sum up with some key take-home messages at the end. So over to the first video, please.
Hi, my name's Dawn Allen and I'm Public Advisor for the CHI theme. And I'm here today with Sarah Rogers, who is the lead for the CHI theme. Hi, Sarah, how are you doing?
Hi, Dawn. Yeah, good to be here.
I just wanted to ask you a few questions, a bit more about the strategy and you know, all the different things that have been going on at the moment, well, over the last 3 years, really. And could you just tell us a bit more about how the strategy came about and how it's evolved?
Sure. So it was first written, 3 years ago now, as part of our funding bid to the National Institute of Health Research. So what we wrote back then that was suitable for our fellow academics and funders isn't really as suitable for our member organisations, and things have changed a lot over the last 3 years as well. So we wanted to update it.
And can you tell me more about, you know, how things have been updated and what that process has been like?
Sure. So, well, what we want to make sure is that things are still relevant. It's a fast-moving area, and it's 3 years since we wrote it. So we want to make sure that it's of interest to our member organisations, such as the new integrated care system and local councils throughout the North West Coast region, while also making it accessible to our public advisors and still using it to track our progress. So really, it's not purely a strategy document now. It contains lots of the progress that we've made over the first 2 years, as well as our future intentions.
Yeah, and I know I've been a part of the process as well. I've been having a look through and started making some changes to the document and sort of rereading it back from a layperson's perspective. Are there any particular highlights that you think that stand out that are quite unique about the strategy?
Yeah, so, well, first of all, your comments have been really helpful in translating it to a wider audience. But I think a highlight that really sticks out for me is the work that one of our key contributors to the ARC has done over the past 2 years, and that's the Combined Intelligence for Public Health Action Database, or data bank. So Ian Buchan has worked really hard to secure lots of different data providers and building a new data bank for a population of several million people across the Cheshire and Mersey, and I think maybe even slightly wider afield. And this is a really important development because our CHI team are making the data more useful as well. That's the function of the Care and Health Informatics team. So the information, all the routinely collected health data, such as hospital admissions and GP visits, are all being collected together, and we're trying to make the data more useful. So we have a team member called Ollie Butters, who calls himself a data wrangler, so he can help pat the data into shape so that it's more useful for researchers to use in their applied research projects.
That sounds really interesting. And if people wanted out there who were listening and watching today wanted to get involved in being part of that process of maybe having a look at the strategy, where would they be able to look up where the strategy is, and how would they go about getting in touch?
So we'll put a new version up on our website, on the ARC website, and we'll put that in the chat so that you can have a direct link to it. And we also have a team team email address, sorry, as well, so called kaiquery@liverpool.ac.uk. So we'll put that in the chat as well, and we'd be happy to receive feedback on it. If there's bits that you don't understand or duplications of work that we're doing that our member organisations might be also doing, and also prioritising our work for us to make sure that it's most useful for you. That would be really helpful.
Thanks very much for explaining that. I think it's always useful for people to know, that they're welcome to be part of the process for making the changes and having a look and making any other suggestions. So it's been great to speak today. Thanks very much.
Thanks, Dawn. Good to speak to you. So that was a short introduction, everyone, to our strategy so far. We had 8 objectives as part of our short-term strategy and have achieved these in our first 2 years of ARC as we set out. Some are naturally ongoing, such as ensuring that we have direct public advisor involvement in our data governance processes. So that's making sure that we're using routinely recorded health data for projects that are important to our members and that have an equity focus for our population. So now we have 5 medium-term objectives that we'd like your help in prioritising. Is there anything that we have missing as well? Is there one that's more important to you? And we'd really like your input. So just to explain, I'm going to try and share my screen so you can see some of these on the screen. Can I share my screen? Yes, I think I can. Desktop 2. So on the left-hand side, you'll see these in order. There you go. Those are just out the left-hand side that you're seeing there. So these are our original objectives that we said we'd do in years 3 to 4. So just to explain what these are. So the first one is about making data accessible while held in a secure, safe haven, accessible only to trusted researchers usually for applied projects. And I mentioned applied projects in the interview. And I just wanted to say, you might a bit more because you might have been wondering exactly what I meant. So an example that I've worked on in the past is a housing and health study. So we showed that by bringing homes up to a national quality standard, emergency admissions to hospital, cardiovascular, respiratory and injuries were halved. And we used routinely collected hospital admissions for everybody. 18,000 people living in 9,000 homes over a period of 10 years. And if we'd only had survey data to follow up, we wouldn't have seen the same results because we'd only been able to capture about 1/5 of the population. And they would likely have been those that were just happened to be home at a particular time of day. So probably older people. People's memories are often short too. So many people don't remember going into hospital or definitely not visiting their GP. So even though they might have had a heart attack and been for an emergency admission, people actually still forget that. So we couldn't have kept track of so many people for a whole decade either because they move around. And it would have been a huge burden on people's time when we can look at their health anonymously without bothering them at all. And just to add then that we looked at the general trends in health for the whole 250,000 people living in the rest of the region that weren't having their homes updated. So we had a really nice comparison group, which makes the evidence more robust. So that's the kind of example that we're talking about. So I'll pass over to Ollie to talk about our second objective.
Thanks, Sarah. So our second objective is it's a bit quicker to explain. It's about making data and code that we've written more easy for people to find, to access and to reuse. And the way we go about doing this is making sure we've got somewhere to put relevant information about it, not it. We're not talking about the data itself. We're talking about information about the data. And by making that easier for people to get access to that information about the data, it should make it easier for people to then get access to data later on because they know what's available and they know whether it's fit for what they want to do. So back to Sarah.
Thanks, Ollie. And so our third one is about submitting funding applications. And I think we're already doing really well on this one, because we've got things like the Civic Data Cooperative funded and Groundswell that we've talked about in previous ARCFESTs. So I think, you know, we don't want to rest easy, but we're quietly confident about this one. And so now we want to use our resources to work with our members and public to achieve something useful to improve their services, and keeping it in the nature of the applied research collaboration. But of course, we're always keen to work with our members on areas that they're interested in to generate new funding successes.
And then our fourth one is, it is quite substantially about visualizations. And you know, if you're in the IPH session earlier this morning, there was some nice pictures of dashboards that help with the decision making. And so we're starting to think about what we can do with that, how we can help people, to understand their data a bit easier.
And so number 5 then is all about equity. And we know that often deprivation, ethnicity and gender are captured poorly in health data sets. So we'd like to work with our partners to examine how these data are collected, and if we can make it easier for clinicians and councils to collect these data so that there are fewer missing values. Of particular importance is deprivation and how this interacts with ethnicity, for example. We think during the COVID pandemic that the combination of both made the virus spread more rapidly to multifamily households, for example. So working out how we can help these populations the most is important. So if you'd like us to have a look at your systems that collect these data, please get in touch. So that moves us on to the ranking part, and we'd like your votes. So we're going to leave this idea board up for the next week in case you can't think, or you haven't got time to think and can't vote right now. But I think if you click on the little the plus sign in the corner, you can actually vote, and we'd like to hear from you using that method. And we also have a comment section as well, and I've just put a couple in to start us off. So yeah, so we'll leave that up for a while, and hopefully you can vote. You could either vote now or wait. And you can add the comments in the right-hand side of the board, either anonymously, or if you want us to get in touch and just want to write a brief comment, then we'll get in touch with you if you leave your name and a way of contacting you. So I think that's it for this section. So I think we're going to have to move on, because we've got a really exciting presentation now on Puma, which has nothing to do with cats. So I'll let the host play that video.
Stop share, please.
Hi, good afternoon, Oli, and good afternoon to everybody. My name is Dr. Sakeji. I'm one of the co-lead for ARC Northwest, and I'm just here today to tell you about this new project we've got that will be very good for all of us.
Hi everybody, my name is Nahita here, and I'm a public advisor at ARC Northwest Coast. I'm also the chair of the Public Advisor Forum, and we're here today with Ollie, who's going to introduce us to a new platform that's called Puma, which sounds really interesting, and hopefully it's going to help all of us. Over to you, Ollie.
Hi, thank you. Yeah, so I'm Ollie Butters, and I'm part of the Care and Health Informatics team. And this is a web project we've been working on to look at publications for a little while now.
Thank you, Ollie. Now, you just mentioned that word Puma. What does that stand for, please?
So Puma, so it's the name of the project, and it stands for the Publications Metadata Augmentation System. So Puma sounds a lot better than that now.
Yeah, thank you so much.
Yeah, it does. Well, I'd like to know, Ollie, what is it that we're trying to address with Puma?
Sure. So with most research projects that go on in universities, one of the outputs of that would be an academic journal article, and that sort of summarizes everything that's gone on in the work, you know, the methods, the results, all the conclusions and everything. But what we often find is that projects put big lists of these journal articles on their websites, perhaps just lists of titles of papers and this sort of thing. But that's not really the easiest thing to get into. You know, if I go to a project website and there's a long list of titles of papers, it can be quite difficult to find a subject that's relevant to me. If you take an example of something like social prescribing, for instance, if I want to find that in a list of titles, I might search for the words social prescribing on the page. But what if those exact words in that order aren't used? What if it's socially prescribed or something like that? Then it gets really difficult to find relevant information. And so we've come up with a tool which uses metadata to try and make it much easier to find and explore lists of publications.
Wow, thank you so much for explaining that to us, really. And you've just mentioned another big word, which is really strange to me. And what is this metadata you speak of?
That's a really important question. So metadata is data about data. So it's probably best to think of it as with some examples. So imagine when you take a picture, a photo with perhaps your mobile phone or a digital camera or something, the data bit of it is the picture itself, you know, the picture of your cat or the sunset or your food or whatever you're taking a picture of. But alongside that, there's extra information that gets captured. So think about perhaps the time the picture was taken, or GPS coordinates, or the model of the camera. There's loads of stuff. So all of that extra information is metadata. Another example might be when you make a phone call on your mobile phone. So the actual data bit, the bit that you're interested in, is the conversation that you're having with somebody. That's not getting recorded anywhere, but there's extra metadata that's getting captured, like who you're phoning, what time did you call them, how long was your phone call, and that information gets stored on your phone. You might see it in your call history or something like that. So in a similar way, when we look at academic publications, if we think of the journal article itself as being like the data bit, then the metadata that we're interested in would be the list of the authors, perhaps which journal it's published in, how many citations it's got, keywords and this kind of stuff, describing what's going on in the paper. And so that's the metadata that we're interested in. And there are services and websites and stuff around that collect all of this metadata together for other people to build tools to connect to and use. And that's what we've done with Puma.
Wow.
Thank you very much.
Yeah, that sounds amazing, Ollie, really. But after all that, what I would really like to know is it possible for us to see it in action?
Absolutely.
Great.
So
Nice.
I share my screen. I will give you a live demo. Right, so with any luck, you'll be able to see the front page of what Puma looks like. So here we've got, this is a beta test version for us. This isn't quite the live version, but it's getting close. So here we've got a list of 3 years, so the 3 years that the ARC has been going, and it shows us how many papers are published in each year. And we've got 122 here so far, so that's pretty good. And it also shows us how many citations we've got in total for each of those papers. We can drill down a bit, so let's have a look to see what's happened in this year, 2021. So we've got 55 publications here. So this list is already a bit more in-depth than the kind of stuff that we've got available on the website at the minute. So we've got titles that's there, we've got the author lists, we've got links to where you can download the data, we've got information on the journals, and we've got citation counts. So citation counts are when other journal articles reference this journal article. And that sort of gives an indication of how much it's being used in the field, how much people are referring to it. But there's a really long lag with when a paper is published to when it starts to get citations. You know, it can take a year, 2, 3, maybe 4 years for subsequent papers to be written and then start citing the data. So on the right-hand side, we've got these little, quite colourful little donuts, and those give a different view to usage, a bit more real time. So if we look at this, let's say this third one here, this identifying how COVID-19 related misinformation reacts to the announcement of UK national lockdown. So if we click on this little donut here that's got 45 in the middle, this will take us to an external website which shows us how often it's being used in other things. So the donut is mostly blue, and over on the left-hand side, you might not be able to see it, it might be a bit small, but it tells us that it's been tweeted about 26 times. And it's also been in 1 blog article and in 3 news articles. So that's pretty cool. You know,
yeah, that is.
It is, yeah. I mean, we can look at it and we can see people are talking about this now. This is real interaction with this work. So that's very cool. We like that. So if I go back to this page, so we can see we've got those for almost every article that has been published. So we get an idea of what people are talking about. If we have a look at the keywords. So here we've got a list of all the keywords that are on all of the papers. So I mentioned social prescribing earlier, so let's look for that as a keyword. Social prescribing. So on this page, we've got 4 publications that have got social prescribing in the keyword. And as I suggested earlier, you know, sometimes the way it's referenced is different. You know, it doesn't necessarily say exactly social prescribing in the title. As this first one shows, where it's a socially prescribed community service. So you wouldn't have found that if you were looking for the words social prescribing on the long list. And if we look at I think the third one down, the third one down doesn't even say anything like social prescribing in the title. So you would never have found that. But because the article itself does talk about social prescribing, it's had that keyword assigned to it. So we know we could look at that if we're interested in social prescribing. So it helps us to you know, find those relevant subject areas that we want to look at.
Yeah, definitely.
If we have a look at a map of where first authors are. So as you'd expect, we've got quite a lot of little dots in the northwest. There's also quite a few around the country. So that's where we're collaborating with other institutes, perhaps different ARCs on different projects, and where they are the first author on the paper. And somebody in our ARC is a 2nd, 3rd, 4th, whatever author. Then we've got some fairly simple study metrics. These are based a lot around citations. So I think I mentioned earlier, we've got 282 citations on our 122 papers so far. So that's 2.5 citations per paper on average. And we've got an H index of 8. So we've got 8 papers which have got at least 8 publications. Then we can start to draw plots of these sort of things. And I mean, so with the lists that we currently have, it's very difficult to draw any sort of inference about who's using papers. And that's where this citation work comes in. And we can start to think, as time goes by, are we getting lots of citations on perhaps a small number of papers, or are we getting sort of a medium level of citations on lots of papers? You know, do we need to think about who we're engaging with? Do we perhaps need to start pushing particular papers to our members to get them to use it? That sort of thing. But that's not something we can currently do because we just don't have the metric. So this is a sort of a step in that direction. And then the last thing I'll show is a word cloud. I love a good word cloud.
Yeah.
So this is a word cloud of the abstract text from 98 of the 122 publications. So we don't have all of them because not all of the papers have abstracts in their metadata, but for the ones we do, we've looked at the frequency of all of the words in the abstract, and we plot it on here: bigger words, more frequent words, and we get rid of words, common words like and if and of and that kind of stuff. And so this sort of gives us an almost real-time retrospective look at what's gone on in the ARC so far. And so it's reassuring to see that we're looking at health, study, participants is a really important thing. It's great that that's coming through in the research that's coming out. I think I can see data in there, which makes me very happy. And so there's lots we can sort of look and read into this sort of quite simple analysis. And this all gets updated in real time. So as we add new papers, as new papers are published, they'll come into all of the stats and everything that I've shown, and it will all get updated, and we can keep looking and try and get some insight as to what's happening.
Thank you for that. That was really good, Ali. I think one of the questions I would like to ask, and that probably everyone is sitting there thinking, is the authors. So how about a bit of fun? Can we search for Mark Gabbay and see how many publications he's got?
We could do that. So he's on 24 out of the 122. You had me worried then. I thought I might spell his name wrong.
And shall we have one public advisor as well? How about you, Dorcas? Akeju. A-K-E-J-U?
Okay.
Brilliant.
That's brilliant.
It is, yeah. I mean, this is something as public advisors that we've always wanted, is just to know where our names are. I think, yeah, it's really a great platform.
Yes.
Anything you'd like to ask, Dorcas?
Oh, yes. So much to ask Oliver, but we haven't got much time. And really fascinating to use. And you mentioned about the partners and the public. When do you think it'd be open to the general public, and will they be able to access it?
Yes, so I've stopped sharing my screen. So absolutely. I mean, that's such a key aspect of what we're trying to do, because there's no point doing research if we can't get it out to practitioners, to other academics, to the general public, to as many people as possible. Otherwise, it just it gets published and then gets left.
The whole idea is for people to know what ARC is doing, isn't it?
Yes.
So if they can't access it, what's the point? So I'm really glad that it will be open to the general public as well. Thank you so much. Now you got one question again, haven't you?
Yes, I would like to know, when are we all going to be able to use this? So when is it going live, Ollie? Soon.
So we're just doing a bit of beta testing with the comms group. See if there's any little bits and pieces that I left out, any extra functionality that it needs, perhaps a bit of dash of color here or there, who knows. And then hopefully we'll go live in the next month or so.
Brilliant, that is amazing. And what platform is it going to be? Is it going to be available on the ARC website, Ollie?
Yes, so the plan is that it will replace the existing list of publications on the website. So it will be completely integrated to that.
That's brilliant.
So if we could have the other 2 videos now, please. Thank you.
That was an abrupt finish because they were all very excited, weren't they? Wanted to carry on asking questions.
Hello, Lee. It's nice to see you again, and we've invited you today to talk to us about your data science internship that you've done with the support of ARC Northwest Coast. So can you tell us a little bit about yourself?
Hi George, thanks for this. So my name's Lee Hughes. I'm a speech and language therapist with East Lancs Hospital Trust in the Neuro Rehab Service. I work at Rakehead Rehabilitation Centre, which is based at Bethany General Hospital, and in the community for the Community Neuro Rehab team.
Thank you. And what attracted you to apply for this internship with the ARC?
So in our service, we're lucky enough to have a Professor of Neuro Rehab, Louise Connell, and Louise drew our attention to the internship, and I have been looking for a service development research project that would fit in with my part-time work, because I work part-time for the trust, and this seemed ideal, and it would help us look at our service and how we could improve our service.
Okay, thank you. And could you tell us a bit about the project itself? What is it that you're actually looking at?
Absolutely. So ultimately, we are looking at our service and the therapy that we provide to see that it is fair and equitable. So the data that we're looking at is routinely collected data. That's clinical data that we already have from other meetings and outcomes and patient notes, but it's all been sort of routinely collected, anonymized on another database. And we felt that we weren't using that data really effectively, and that there would be lots of sort of hidden gems in that data that we could use to look at, compare our services with other services and improve our service. So it was a project to really harness that data, analyse it and see what we could get from it to improve our service.
Okay, and what kind of support have you received from the ARC whilst you've been doing the internship?
I've had supreme support from Rebecca Wilson, who has been my sort of support mentor, data supervisor. She's been extremely patient with me. So we've had weekly Zoom meetings pretty much, or at least fortnightly, to look at the data, give me ideas on what else to explore, to analyse the charts, the graphs, support me with Excel and the statistical analysis for the charts, because I was quite new to that. And then in the beginning, I've had a lot of support from Louise Connell and Suzanne Ackley at UCLan in terms of the broader picture, thinking about what questions you might be exploring, how to organise a project like this.
Excellent. So it sounds like you've had a good level of support from the ARC and from the academics at UCLan as well. So that's good to hear. So what are the plans for the future for this project? What are you going to do with this data?
Well, I'm excited to find out this week that we've actually just been accepted for a poster submission to a British Society of Rehab Medicine conference, the Society of Research into Rehabilitation, in November. So we've got a poster presentation to get cracking with for that. So that's good to sort of promote the project, promote the service, and encourage other people like myself, clinicians like myself, to have a go with a research project. But also more importantly for the service, we're going to be looking at the outcomes. So I have looked at, for instance, the data that we've got. I had to spend a lot of time cleaning that data. months and months, to be honest. So a lot of the data was incomplete, or the sort of like the wrong data was collected. So I'm going to be able to say, we're already talking about it, but because it's been, you know, an ongoing project where I can feed back on a regular basis to the team, but to say, you know, I think we need to change what we're looking at, change what we're collecting, influence what needs to be collected in the future, work towards what the targets are in neuro rehab and collect towards those. And a lot of the data that I'm looking at will hopefully be evidence to help with workforce planning. So looking at, for instance, you know, therapy resources, physios, OTs, speech and language therapists for neuro rehab services across the region. What else? I don't know whether you're going to ask me a question later, but I was just going to say about how, you know, how an impact for me has been my confidence in carrying something like this out, and how I can, you know, encourage other colleagues to do it as well, to apply. You know, so having something like the ARC there has really sort of structured it for me, and you know, I would really encourage anybody to have a go and apply.
That's good to hear from our perspective, from the capacity building work that we do, that you can go back and almost be an ambassador for the ARC to say, these internships, they're really useful, they've helped me develop, but they've also helped me look at data in different ways to help influence patient outcomes and workforce planning as well. So I think there's been some good outcomes from the work. Is there anything else that you'd like to tell us?
I think, I know the ARC is very interested in trying to improve the health inequalities, and I think that's hopefully you know, we haven't finished charting all the data and analysing it, but definitely that's one of the outcomes of this project. I think will be us to be able to, and it's something that we haven't looked at in our service. So we'll be looking at describing demographics. So we haven't really described our population, so we can describe our population. We can do comparisons with, you know, other population demographics, and look and say, well, is our service, like I said before, fair and equitable? So an example is, what percentage of our neuro rehab patients match the national targets that are set in stroke services for the amount of daily therapy achieved? So, you know, are the neuro rehab services matching those stroke services that have had a lot of development and input in? And I think already, I think I can say in some of the areas we are, and in some of the areas we aren't. Some of that's due to incomplete data, but it is helpful to know where the gaps are, and then how we can work to sort of fill those gaps.
Excellent. So in many ways, it's going to help shape how the service is delivered in the future, and where there's room for improvement, and where you're meeting standards, and where you need to do a bit more work.
Yeah. So I think it's something that we'll just basically carry on. So the ARC and this project has started it, but it showed us how we can do it and how we can then embed it into our sort of service on a sort of like 6 monthly or annual basis.
Lovely. Thank you for your time today, Lee. I really appreciate you taking the time out to talk to us, and to the ARC members that are watching this today to find out about your project. And thank you, obviously, for banging the drum, beating the drum for ARC internships and saying how good they are. We really appreciate that.
Oh, it's a pleasure. Thank you.
I think we've got Bethany now, haven't we? Yeah.
So hello everyone, and welcome to ARCFEST 2021, the September edition. I'm Sam Meredith, a PhD student at the University of Liverpool, funded by the ARC, and I'm here today with Bethany Gill of UCLan, and we just want to introduce her to you all and talk a little bit about her and her PhD project. So Bethany, you want to tell us a little bit about your background and how you become interested in research?
Yes, so a few years ago I did a degree in psychology at the University of Manchester, and I really enjoyed the research elements of it. So then I went and did a Masters of Research in psychology. Then after that I went and got some health research jobs at Lancaster University, and I've been working there for the past 4 years before starting my PhD in June.
Nice, so a nice steady progression then into public health research. So the title of your PhD project is an evaluation of the impact and implementation of telemedicine in health visiting services in the Northwest Coast during COVID-19. So I know the word telemedicine's been popping up a lot during the pandemic. So do you want to explain to us a little bit about what telemedicine is and what your PhD project is about and some of the long-term aims of it maybe?
Yeah, so telemedicine involves delivering healthcare at a distance. So whether that's using telephone calls or video calls to have some interaction with a healthcare professional, whether for some information sharing or an appointment or some monitoring of health. And it has been used previously, but it's used a lot more at the moment because of the COVID-19 pandemic. And one service that has been using telemedicine is health visiting services, who provide care for families after a child's born up until the child is 5.
Yeah.
So normally they've been face to face. Now they're mainly at a distance, and I want to see what has that been like for the families in receipt of the care, but also what has that been like for the staff who have been implementing this new way of working.
Nice. So you're very much looking at telemedicine pre and post COVID then?
Yeah.
And yeah, so what type of analysis will you be doing? Do you know yet? Do you know what the project aims are, or long term what you're trying to find?
Yeah, so long term I'm trying to understand what is the impact of telemedicine, who does it work for, how does it best work, and what can we do to ensure that when using telemedicine we mitigate health inequalities. So I'll be doing a mixed methods PhD, and I'll be using qualitative interviews and some statistical data analysis to find that out.
Nice. That sounds interesting. Sounds good. So what have you got coming up in the short term then? We know what your project's about. Have you got anything coming up in the near future? And is there a way for people, public advisors, academics listening today to get involved? Maybe they're interested in the digital divide and telemedicine. How can they reach you? And yeah, do you want to talk a little bit about that?
Absolutely. So I'm currently in the process of recruiting public advisors. I have got one person who's so kindly agreed to work on this project with me already, but if there's anyone else that would be interested in my project, it'd be great to get in touch. Yeah, also anyone with a professional background in this area or a public interest or an academic interest, if you're happy to have a conversation and act as a sounding board, it would be brilliant to hear from anyone. The best way to get in touch with me is by email, and my email is bgill2@uclan.ac.uk.
Great stuff. So Bethany, thanks for speaking to me. I'm sure Chai, glad to have you on board. Sounds like a great PhD. And to everyone at ARCFEST, I hope you enjoy the rest of your day. So cheers for listening.
So because I thought we were going to run out of time, and I think we almost have, thank you very much for attending today. And I put some comments in the chat, and we'd love to hear from you, and maybe we can build in more discussion in our Kai theme session next time so that we can actually talk to each other. So that would be good. Obviously we were so excited about having so much to share with you. But if anyone would like to say anything in the last 2 minutes, then please go ahead, and I hope we don't get cut off. Thank you very much for attending today then, and we look forward to hearing from you, and hopefully seeing you next time.